Southpark took on the American healthcare system and honestly represented it way too accurately. Let's take a look at a little bit of what they did.
Sorry, but we don't pay for medicines for obesity because it's not a disease.
Who was that?
That was the medical director. The medical director decides what claims are valid for us to pay for.
But you didn't say who the patient was or what was wrong with him.
Right. The medical director's job is just to say no.
Look, my friend's mom has been paying you people for years, and his doctor says his weight is a medical concern and obesity is a disease. Oprah Winfrey said so.
Okay, calm down. I didn't realize I was dealing with someone who had so much determination. If you do a little more work, I think we can get your medications paid for.
What, we can?
Yeah, you see, the doctors and the pharmaceutical companies and the insurance companies all kind of work together. So all you have to do is navigate the American healthcare system.
We go back to the doctor, we go back to the specialist who talks to the insurance company, the faxes, the medical advisors on the phone in the mountain. And we're going in one place and we're coming out the other place. And we're back over here now, and I was just over there. And I'm getting confused, and it's getting dark. And my mind is all different colors. And I think I'm lost. Hey, fellas, I think I'm lost in the American healthcare system.
I don't think there's anyone in America who has interacted with our health system at all who does not relate to that situation, where you just know, no matter what it is, no matter whether you have, I mean, this is for people who actually have insurance, right? This is like the best case scenario.
Exactly.
You know it's gonna be a nightmare. You know you're gonna get some crazy bill. You know things that you thought were gonna be paid for are not gonna be paid for. You know there's gonna be 18,000 forms for you to fill out, none of which are really comprehensible. Like, it's just complete insanity, and it's not like we get good health results on the end of it either.
Right, so the key thing to take from all of this nonsense is that they are, what I love this is that it makes it so crystal clear, and it also demonstrates that it is a cartel, which we often, focus in on one thing, the pharmaceutical company.
Right.
And sure, they should be demonized. Or we focus in on the insurance companies. It's the doctors too. And that is why it is so perfect, because it's like, well, the doctors work for the hospital system. The hospital system works with the drug company who works with the pharmaceutical company. And the three of them come together. Their job is to say no, but obesity is not a disease, but you could pay for this if you have this complicated maneuver. I highly encourage people to understand and to really look at what their actual payments look like for drugs. There are pre-negotiated rates that insurance companies are allowed to pay for drugs, which are much, much higher than they actually cost if you were to pay for it out of pocket. That then gets dinged out of the amount of allowable spend that you actually have in your plan. None of this matters if you're healthy, but if you're old, you can hit that number real quick, and then you end up paying out of pocket, but you're paying out of pocket at the higher rate that was previously negotiated. It's a scam. It's a total scam. And the doctors are just as complicit as anybody in this, not even in the corrupt way of like them hanging out with pharma companies and all of that, but in terms of the way that they work the health system to keep their salaries incredibly high. Yeah, I'm not saying that they don't have very tough jobs and they shouldn't get paid well, but part of the reason is the American Medical Association, which itself is a cartel. There's all this stuff that is happening. So Southpark, as usual, is able to just like pierce, at the very, very heart of the issue. And this episode is actually the most culturally relevant one that I've seen in a long time.
It's the first one that's really sort of like,
it's been years since I've seen one.
Pierced through.
Well, actually, no. The Harry and Meghan thing was really good.
Oh,
too.
that's I forgot we covered that.
Yeah, Harry and Meghan was also
I actually
incredible.
watched that whole episode.
Yeah. I mean, look, I love South Park. I've been with them from the beginning. Trey and Matt, Book of Mormon, basketball, everything they've ever done, I've encouraged it. But this one seems to have broken through both Twitter, Instagram. I've seen it everywhere for the discussion.
Yeah.
And it's because it just takes, it just shows you the deep rot of the entire system. And Ozempic too, a lot of the discussion, it really does seem to show everybody what this whole thing is about, because you see food companies that are now creating Ozempic-friendly foods. You see Novo Novartis, which is one of the makers of Ozempic. I mean, they are making so much money. They have to, when they convert dollars into Danish kroner, the Danish central bank has had to adjust its currency rates or whatever because they're inflating the kroner. That's how filthy rich this company is becoming. Now you've got these competitors. I just read about Hims or whatever it's called. It's coming out with an Ozempic competitor that only costs $500 a month or something like that. And these people are making so much money off of the backs of this, and it just shows us where Preventative care is so much cheaper, like to not get obese in the first place, but sick care or, the current medical system, even Ozempic, where you treat somebody for obesity after they're already obese, that's where all the real money is.
I mean, if you're putting profit at the center of healthcare instead of health at the center of healthcare, you're going to get a disgusting, effed up system like what we have that does not give us health or care. Let's put this up on the screen just as one metric, but a pretty important one. Here is the life expectancy rankings for every country in the G7. And you guessed it, that dark blue line that is falling off a freaking cliff, that would be the US. And we spend more in healthcare than anyone else, okay? We're getting completely ripped off because the beating heart of the whole thing is corruption and corporate greed. So yeah, here's what you need to understand. Our healthcare system is succeeding wildly because it's set up to turn profits for the people at the very top. And it is doing that phenomenally well. It is not set up to provide good healthcare or good service or any of those things to you. And so it doesn't provide those things. So that's not what it is all about. It's all about making money. And at that, it succeeds phenomenally. And meanwhile, you are getting robbed. And here's the thing that this made me realize is it's almost like we've just like given up. We've just given up on making it better. There was obviously huge energy around Obamacare. Obamacare made some marginal improvements, at least people, pre-existing conditions.
Yeah.
Like there were some things that were better. You wouldn't want to go back to the pre-Obamacare days. They were marginally worse. But it's not like it fixed or changed the fundamental dynamics at all. Not at all, okay? So you had that moment. Then you had the Bernie Sanders moment, and you had a bunch of Democrats pretending like they wanted Medicare for all. You had huge public sentiment, especially on the Democratic side, but also among independents, and a fair number of Republicans too, who were like, yeah, that sounds better. And Medicare actually, does a better job of controlling costs, et cetera, et cetera. Like, let's move in that direction. Bernie loses. You end up with Joe Biden. Joe Biden on the campaign trail is promising, we're going to do the public option. That's my thing. We're going to take Obamacare. We're going to make it better, public option. There was some discussion about moving down the Social Security age as well and Medicare age as well to help people out. That's gone. Like, he doesn't even pretend. For this reelection, we don't hear about healthcare at all. It's just fallen off the table as a priority. And yet there's a reason why this strikes a nerve. Because even if you are a person who has health insurance, which is the best possible scenario, the healthcare system is still a total and complete nightmare, even for you, even if you were in the best possible situation. So God bless them for at least shining a light on.
And that's what I would say about Obamacare. It's like, yeah, net-wise, it's better that people have insurance than not. But, the whole, if you like your doctor, you can keep your doctor, disaster. That didn't work out. Premiums have gone sky high. The insurance companies have been the greatest beneficiaries of Obamacare. So look, the whole system is such a mess, I mean, for example, our own thing. It's like, yeah, it's cool. If I get hit by a bus, I'll be okay. Otherwise, I'm going to be out like 10 grand. There's so many.
I just assume
and it costs
they're not going to pay for anything.
Right. It costs hundreds and hundreds and hundreds of dollars a month. And I'm like, what am I paying for? Exactly. And that's off of the so-called public exchange or whatever. This is the common for, so many people out there. And if you have kids, God bless you. I see families out there who are paying like $700 a month, $800 a month.
It's insane.
And if your kid has asthma, good luck. Hope they pay for the first 3 inhalers. After that, you're out your own. You've hit your max.
Yeah.
And that's what the Southpark episode, illustrates, where especially with obesity is probably the #1 crisis, I would say, health-wise, because it is the precursor to so many of the ultimate killers, not to mention it just exacerbates and makes everything else much worse. It is so much easier to do Ozempic or any of this other stuff instead of actually having some preventative care, our food system. It's funny too, because you pointed to Japan. Japan is one of the great examples of the seed oil paradox. Everyone's like, oh, it's our food system and all of that that's poisoning us. It's processed food. Well, in Japan, they eat a ton of processed food. They eat seed oils. They fry their steaks in seed oils, all kinds of stuff. People who are obsessed with this discourse talk about it. It's just that they have a different culture, both around healthcare and around the way that they eat. and it's a fulsome approach that is deep in like Eastern medicine and
Don't they
just
eat more
Eastern
like Whole
understandings.
Foods than we do, though?
So,
like,
no,
more
certainly.
like, yeah.
But I'm saying they have
Fish
highly,
and-
highly palatable processed food that's around them, but their culture somehow is able to deal with that, and they don't all become morbidly obese. So it's just an example of you can have access to highly processed food, to seed oils, to drinking, all of this. But if you have a good culture, it's very easy to resist that, or at least they have found it able to. I don't think they're all that different from us, but our culture, our medical system and all of that are basically, one unit which is designed for consumption to get you fat. And then once the healthcare system does kick in, it's after a lot of the damage has been wrought, as opposed to from the very beginning.
Sedentary lifestyle, everything's get in your car and go everywhere, tons of like subsidies for like the worst kind of foods. That's what's cheap and easy. You have people who are super stressed. This is what's, simple for them to get, or most least expensive for them to get, easiest to put on the table. You have no incentives in the healthcare system for preventative medicine. You have a lot of people who've had a lot of terrible interactions with the medical system, so very reluctant to engage with it at all. When there is a problem, you just add all of these things up, and it's clearly a recipe for disaster, which we're experiencing. How many times have we talked on this show about how like the most basic metric of how you're doing as a society?
Are you living or dying?
Are you living or dying? Those numbers, and it's not like you can look at it and say, oh, well, this is happening to the whole rich world. No, it's not. No, it's not. It's happening to us. We are uniquely falling off a cliff in terms of life expectancy, and doesn't seem to be a priority for the political class, even as, shipping more bombs to carpet bomb babies in Rafah is a very high priority. But making sure Americans can actually live, not so much.
One of the craziest things that I found, because I was doing some life expectancy, I did a whole monologue about this. So for example, US life expectancy right now is 75 years old. Gone down dramatically 2020 to 2023. It is not just because of COVID. Yes, COVID was certainly an exacerbating factor. High rates of overdose death. The really gross part is that in the United States, if you're rich, you live a lot longer.
That's right.
If you're in the top 10% in the US, you're gonna live till like 90 years old. That's your average life expectancy. And what drags everybody down is a lot of poor people, people who are unhealthy, don't have health insurance, and get themselves in a bad situation, wait to go to the doctor.
Can't afford a healthy lifestyle.
Can't afford a healthy lifestyle. It's like, if you, for example, here I have it right in front of you. If you're in the top 1%, men who have much lower income, who have much more life expectancy than women, your life expectancy is 87.3 years, whereas average male life expectancy in this country is 75. So you live 15 more years if you're in the top 1% of
crazy.
income. Yeah, so think about that. That's what money can't buy you happiness. It can buy you a lot of years on this
decade
earth.
plus.
Right.
And that again is not.
That is not common. Exactly.
That's not
in most
everywhere. Like we
countries.
take these things for granted, but that is uniquely American phenomenon that we've just accepted. The political class has accepted, and as I said, the most depressing thing to me watching this is like everyone seems to have just like given up that this can even ever be changed.
Yeah.
So,
by the way, the same discrepancy with women. If you are in the top 1% and you're a woman, you'll live till 89 years old. That's your average U.S. life expectancy, which means half of those people are living to like 100 years old. So that's what that number can really show you. Hey, if you like that video, hit the like button or leave a comment below. It really helps get the show to more people.
and if you'd like to get the full show ad-free and in your inbox every morning, you can sign up at breakingpoints.com.
That's right. Get the full show. Help support the future of independent media at breakingpoints.com.